All right, graduates, please be seated. Good evening, everyone. Welcome to the Roseman University of Health Sciences College of Nursing, ABSN February Class of 2022 Pinning, and MSN Family Nurse Practitioner July Class of 2022 White Coat Ceremony. I'm Dr. Brian Oxhorn, Dean of the College of Nursing. Let's clap for them. This is exciting. Come on, this is Vegas. Let's get excited here. Thank you. This is a great day for all of us. For educators, this is the culmination of the sharing of our knowledge, skills, and attitudes towards both our entry-level and advanced practice nurses. As families and loved ones, this day represents the fulfillment of the dreams and aspirations of those closest to you. For graduates, this day represents socialization into a profession dedicated to the needs of others and improving the health experience. For others, this day represents an expansion of the scope of practice to improve health outcomes for patients and populations and provide needed healthcare services to the fullest extent of their capabilities. This may also represent the end of a long, challenging journey. However, this is likely not the end, whether through new nurse residencies, continuing education, or a return to formal academic nursing education. Our profession is all about lifelong learning. Healthcare is a dynamic world. New technologies, new discoveries, and new patient interactions will continue to challenge the knowledge, skills, and attitudes you have mastered in your time at Roseman. Today, you are no longer student nurses or student nurse practitioners. You are now graduate nurses and graduate nurse practitioners. Yeah! And over the next few months, one by one, you'll be calling yourself registered nurses or advanced practice registered nurses. I welcome you to our profession, and I welcome others to the role of provider. I am honored to have been a small part of your journey, and congratulations. Please let me welcome to the stage the president of Roseman University of Health Sciences, Dr. Renee Kaufman.
Well, good evening, and on behalf of the Roseman University Board of Trustees and its administration, I'd like to welcome all of our ABSN and MSN graduates, as well as all of the family, friends, and loved ones that are here with us tonight. We are very pleased and proud of the journey that you all have taken, and let me be among the first to congratulate you. We look so forward to all of the great things that you'll do in the profession of nursing and making Roseman proud. At this time, it is my great pleasure to introduce the Chancellor of the Roseman University Henderson campus, Dr. Eukarya Nadi.
Thank you, Dr. Kaufman. It is a celebration, correct? It is a happy occasion, correct? Congratulations to the class of 2022. Okay, you just heard Dr. Oxhorn tell you that it's not the end, this is the beginning, correct? Okay, now, envision, think, where do you want to be the next 5 years? Where do you going to be in the next 10 years? Think through that. And let's start that planning now. Whatever you have in mind, whether you want to be a nurse anesthetist, you're going to be a nurse executive, you want to be a professor, you want to be a charge nurse, you want to be a president of a university. Now, how do you get there? Do you need experience? So we start with this board exam. You're going to nail this board exam, right? All right. Now we know you are going to get to that goal, whatever it is, because you have a Roseman degree. So if your next goal is to go back to school, you can do it. You can nail it. You just showed us today that you can. You have a degree that most of us don't have. You have a degree where you are required to perform at 90% all the time. No other program is going to require more of you. And to get to that goal you have in mind, you have to pay attention to details. Because we, who will be your current or future patients, will depend on you. You cannot afford to make any mistake. There is no such thing as a small error. Because in your profession, small error kills people. You make a decimal percent error, that may mean 10 times the dose. And because you are entering a profession that we all trust, we trust you, we believe in you, we will remember you as patients. We will remember you. We will remember that great nurse, that wonderful nurse. Because you are the patient advocate. You are the one that speaks for the patient when the patient cannot speak for themselves. You are the bridge between the patient and their loved ones when their loved ones cannot be there with them. So, you chose a great profession. You chose a wonderful profession. Now, getting back to that goal, whatever you had in mind today, think through it. Do not stop. You have the foundation. Now, lay on that foundation. Whatever that is, whatever the reason that brought you here, carry it forward. Build on it. Make something great out of it. And for those our nurse practitioners, you are now the provider. There is no physician to call. Oh, you are it. So, again, when in doubt, you look it up. You don't guess at it. The patient is now depending on you. You are making the decisions. We are so proud of you. We are proud that you chose to be a healthcare hero. We need you. And congratulations to the class of 2022.
So now please let me welcome and introduce the Roseman University of Health Sciences College of Nursing faculty and staff. These group of individuals dedicate their time and effort to provide these students with the education they need to practice safely in whatever clinical area they choose. Please stand as I call your name. Starting here on the stage, we have Dr. Susanna Winslow, an Associate Dean. Dr. Shanda Clark, Assistant Dean. Dr. Rowena Bermundo, Director of Clinical Resources. Dr. Jason Major. Professor Nancy Bryan. Dr. Barbara Tanner. Dr. Mary Faye Axon Armstrong. Professor Georgine Krieger. Professor Jennifer Morris. Professor Stephanie Maston. Professor Eliza Michelle. Professor Augusta Arato. Professor Robert Fox. And Dr. Federico Calixtro. And out in the audience, we have Miss Donna Lafee, one of our clinical coordinators. Miss Denise House, assistant to the dean. Miss Anya Reisert, mission specialist. Miss Camila Arias Montero, recruiter. Mr. Eric Dillon, admissions director. And please, Miss Christine Russell there, standing there on the edge. And then somewhere out here is Miss Anna Guevara, who helps coordinate you guys. Oh, there she is, behind the flowers. And then on camera, we have Miss Francia Garcia and Miss Annie Ortega over on this side. And in the back, putting this in virtual and YouTube, is Mr. Jason Gibson. And thank you to our student workers to help keep everybody organized here. We appreciate you very much. All right. And with that, we'll welcome Professor Dr. Tanner to the stage to read Tradition of the Pinning Ceremony and Lighting of the Candle.
Congratulations, each and every one of you. You guys worked so hard. Professor Kylie Anders says congratulations as well. She's very sorry she couldn't be here. In the 1860s, Florence Nightingale devoted herself to caring for casualties of the Crimean War. In recognition of her service, she was awarded the Cross of St. George. Florence then extended the honor by presenting a Medal of Excellence to the most deserving student graduates at the Nightingale School of Nursing in London. Today, nursing schools around the world give a nursing pin to represent a Medal of Excellence to their student nurses upon graduation. The Roseman nursing pin is designed in the university colors of burgundy and silver. The shape of the pin symbolizes the unique block curriculum of the Roseman program. Each side of the pin represents the College of Nursing core values: service, integrity, innovation, and knowledge. The lamp of knowledge on the lower half of the pin signifies the nurse's science-based knowledge and commitment to lifelong learning, which are foundational principles of professional nursing practice. The lamp was a symbol of the care and devotion Florence Nightingale administered to the sick and the injured in the practice of her nursing. After nurses were pinned, Miss Nightingale would light a lamp and pass the flame to each nurse as they said the pledge. Today, we carry the ceremonial tradition, passing of the light. We'd like to introduce or invite your class speaker, at this time, Mr. Zachary Blumenstein.
Well, there's a lot more people here. All right. Good evening, everybody. I didn't tell my family that I was going to be doing this, so I'm sure it's a little bit of a shock. I was hoping that the shock factor would save me a little bit of teasing from my siblings, but I already got a little bit of that walking down, so that didn't work. I want to start by thanking the professors for all of their time, patience, knowledge, and experience. You guys challenged us and supported us through this journey, and it's because of you that we are ready to enter the field of nursing and tackle the challenges that are to come. So thank you. We've enjoyed the times that you've spent and shared with us. You've shared your experiences with us as well. So I don't think any of us are going to forget Professor Carley's education of how to prevent red man syndrome with vancomycin. They'll explain it later to you guys. I also want to say thank you to our families and friends and loved ones who traveled near and far to be with us here to celebrate our accomplishments. I also want to send a special thank you to those who couldn't be here with us today. We'll celebrate twice as hard for you guys. We miss you and we love you all. I think I speak for all of us when I say that we definitely could not have done this without your guys' support. Whenever we needed to be tested on questions or practice our physical assessments or just take a break and forget that we were in nursing school, you guys were all there for us. Maybe now that we've graduated, you'll let us practice some IVs on you guys. But I know we've said it a million times, but I'll say it one more time. Sincerely, thank you guys. And to the graduates of 2022, congratulations. Look how far we have come. A little over a year ago, we were learning how to use a stethoscope and take pulses, and now we're graduating. Some of us are going back to school, some of us have already accepted job offers, and some of us are still trying to figure out what ginkgo biloba is, but we are here, we graduated, and we did it. I still remember our first day on campus when Professor Krager was running through our orientation, and it was our first day, and she talked to us about how we need to address the professors as professor or doctor because of all the effort and hours and experience that they put in to earn where they are in their careers. And I remember thinking to myself, this is going to be very hard. What am I doing? What am I getting myself into? And it was. We had a lot of days, long days of studying. We had lots of sleepless nights, lots of caffeine, energy drinks, coffee, and a lot of frustration, but I don't think that we would change anything. Because look where we are today. We're graduating, ready to enter the field of nursing and help make a difference in the world. So, George, I hope you're proud of what we became and what we will accomplish. Congratulations, class of 2022. Thank you so much.
Congratulations to the BSN students and to my MSN FNP students out there. So it is a privilege and honor to stand before everyone today to present the notable achievements of our graduate students cohort. These students entrusted Roseman to provide them with quality education that many of them already had known as Roseman alumni. I speak for all the faculty by saying how grateful we are and a sincere thank you. So with that, I would like to introduce our celebratory event that provides recognition of the high achievements gained by these students as they are ready to embark on their career journey as advanced practice nurses. To signify this, a white coat ceremony will be conducted tonight that is symbolic of their career progression as a new primary care healthcare providers. The white coat ceremony is the oldest and most well-known program of the Gold Foundation. The Arnold P. Gold Foundation established the white coat ceremony in 1993. The first white coat ceremony took place in 1993 at the Columbia University. Dr. Gold was a professor of clinical neurology and professor of clinical pediatrics. He noted that the existing practice having students take the Hippocratic Oath at the end of their medical training occurred 4 years too late. In 2014, recognizing the vital role of nurses play in the healthcare field, the Gold Foundation partnered with the American Association of Colleges of Nurses to adopt the white coat ceremony for nursing. More than 360 schools of nursing now participate, and the number continues to grow. The Gold Foundation instituted the white coat ceremony to emphasize humanism in medicine. Like physicians, the white coat ceremony is an event that many nurse practitioners, students take part to commemorate nursing graduates who are to assume roles in the advanced practice nursing. To symbolize this transition, students are coated by their faculty using the iconic white coat often worn by the healthcare professionals, symbolizing the nurses' transition to the role of healthcare providers. In addition to the white coat, students will be given a pin provided by the Gold Foundation that commemorate the white coat ceremony. Featured on the pin is a gold Mobius loop that symbolizes the continuous bond of trust, respect, and communication, when ultimately humanism is the very center of patient care. We encourage all of you, not just MSN students, all of you guys, we encourage you to proudly wear their pins to remember their oath to keep healthcare human. Thank you.
Please welcome to the stage the Master of Science in Family Nurse Practitioner graduate class speaker, Mr. Jeffrey Clem.
Well, good evening. My name is Jeff Clem, and for those of you that don't know me or would only recognize me in bad lighting on a Zoom or a team meeting, I'm a student in the nurse practitioner program here at Roseman. And I was given the honor to speak tonight about my experiences in the nurse practitioner program. Now, I assume that most of my classmates are probably reflecting on the last 2 years and are astonished by how quickly the 2 years went and how it seemed to just start yesterday. And that's good for them. But for me, the last 2 years have seemed a bit longer. I came to this program with a full head of hair and a six-pack. Now, the one thing that got me through this was the realization that even in the face of overwhelming stress, deadlines for papers that I had no idea how to write, and trying not to look like a complete idiot while giving a graduation speech, that a sense of humor is a fairly effective coping mechanism. And as Winston Churchill once said, "It is my belief you cannot deal with the most serious things in the world unless you understand the most amusing." Well said, Winston. Now, I'm not sure if you're aware, but the pinning ceremony that we are a part of tonight is rooted in history, beginning over 1,000 years ago. The earliest ancestor of the pin dates back to the Maltese cross, which was adopted during the Crusades and was worn by warrior monks whose job it was to attend to wounded pilgrims and knights. These men, called Hospitaller Knights, were famous for their good works, chivalry, and excellent hospital management. It was considered to be a high honor to be a Hospitaller Knight and to wear the Maltese Cross of Service. Now, fast forward a few thousand years, and we too, as nurse practitioners, should realize the honor it is to serve our patients with skills and compassion. Now, in case you were wondering where I discovered this fascinating information, I'm happy to provide you the citation in a peer-reviewed journal published within the last 5 years that I found on PubMed, and I'll even do it in 7th edition of APA formatting. We all love APA formatting. Now, I was asked to talk about my personal experiences in the nurse practitioner program, and these may or may not resemble some of the experiences my partners in the program had. Now, the best part of the learning process for me was doing the clinical rotations, and I'm sure for most of the BSN students as well. I not only learned a great deal from my preceptors, but surprisingly from the patients themselves. Now, for example, I learned from several patients that the NP program, or the nurse practitioner program, was a huge waste of money. Now, hear me out on this. Apparently, there's a free nurse practitioner program out there that imparts an abundant amount of medical knowledge directly into a student's brain in a short period of time. In fact, the enlightenment that comes from this program and education method is far superior than anything at Roseman or any other nurse practitioner school. Now, this amazing institution is called the University of Google, and apparently you can learn to diagnose yourself and develop a treatment plan in less time than it takes you to drive to the doctor's office, get your appointment. All you need is the prescription pad. Now, unfortunately, it creates the occasional problem when a patient insists that they have an extremely rare disease that's only found in remote parts of the Amazon, and you actually know it's just bad gas. And I assume this is why we spent so much time focusing on how to educate our patients, so we would be able to do so with understanding, empathy, compassion, and even a straight face. Now, we did several rotations. Pediatric rotation. I went into pediatric rotation thinking, I'm pretty optimistic on this one. I have 2 kids myself. I adore them. I understand them. I think I can talk to them pretty well. So I figured, how hard could this be? Well, he has a bribe to be good and let me look in their ears. Also, with the whole COVID thing going on, it did impact our learning some. We practiced sometimes on teddy bears and baby dolls because COVID kept us away from people sometimes. Now, my wife and daughter went to Target to buy me a baby doll for my pediatric studies, and they asked the Target employee, where would they find a baby doll? It can't be too young and too small, but it can't be too big and too old. And now I think I'm on a special list because of that. And that moved us into the women's health rotation. Now, let me say this. Being a male who grew up with only a brother, I have a new level of respect for women. It has been made clear to me that standing up to pee is not the only benefit of being a man. I also came to the realization that if men were the ones to have babies, a lot of us wouldn't be here. Now, primary care, this was actually my personal favorite. You get to see so many different types of patients, problems, and conditions. Now, as Forrest Gump said, primary care is kind of like a box of chocolates. You never know what you're going to get. The next patient encounter could be anything from a common cold to a variety of other things that would be bleeding, leaking, oozing. You never knew. Just good times. Now, it would be an understatement to say that the career path we've chosen is unique. In what other field can you encounter joy, depression, melancholy, blood, frustration, various deadly contagions, pain, celebration, fear, relief, exhaustion, fluids of unknown origins, tears, screaming, satisfaction, and success all in the same day, and even sometimes with the same patient? On the good days, you will make your patient's life better, healthier, and happier. You will relieve their pain and alleviate their fears. You will change the trajectory of their health for the better. On other days, you might leave a little stressed, you might leave a little desperate, be in a desperate need, to help diagnose a patient, and you can't even remember how to do a prostate exam. There will be occasions where the available supply of creative curse words will be painfully insufficient to meet your needs, and you would literally give anything for a shower and a NyQuil margarita at the end of a 12-hour shift. But seriously, I believe the best is yet to come for us. We, assuming we all pass our boards, will be thrust out into the real world with real patients who have real problems. And we will be doing so in a world populated with new diseases, as we got to know COVID. Or, fortunately, we will also have the very real opportunity to impact the lives of real people in a profound and positive way, as long as we remember to wash our hands before each encounter. Finally, if there's one thing I wish for our cohort, it would be that even in the face of sobering, stressful, or tragic moments, we don't lose our humanity, our humility, and most importantly, our sense of humor. Because based on what we've already seen, I think we're going to need it all. Lastly, I want to give a big shout out of appreciation to all the faculty and staff up here, the ones out there as well, that have assisted us with our journey to become nurse practitioners and nurses. You have helped guide us and mold us into the nurse practitioners and nurses that we are going to become. And then lastly, congratulations, fellow students, on your successes. And thank you, family and friends, for all your support and guidance that you've given us. Thank you.
All right, and now time for the pinning and white coat ceremony.
Justina Anderson, pinned by Julia Anderson. Madison Benitez, being pinned by Joan Beats. Zachary Blumenstein, being pinned by Sharina Blumenstein. Laura Kane, being pinned by Amy Kane. Frances Kulara, being pinned by Myra Kulara. Roy Alexander Corpus, being pinned by Dr. Vicky Schmidt. Stacy Dona, being pinned by Renato Dona. Jenny Ha Dorsey, being pinned by Chris Dorsey. Trisha Gartley, being pinned by Quinn Gartley and Jeff Gartley. Divya Halthor, being pinned by Guy Halthor. Althrican Herrera, being pinned by Rita Herrera. Gabrielle Caberto Hidalgo, being pinned by Teresa Caberto Hidalgo. Felicia Nicole Holmes, being pinned by Rajshari Starks. Nicole Kelly, being pinned by Darby Kelly. Nicole Karensenko, being pinned by Sam Karensenko. Alberto Laura, being pinned by Gloria Lara. Teresa Lee, being pinned by Kathy Chow. Maria Grace Lim Manuela, being pinned by Mark Manuela. Carlos Lopez, being pinned by Lauren Lopez. Vicente Lujan, being pinned by Jordana. April Navarrete, being pinned by Roseman Navarrete. Sam Yuin, being pinned by Sarah Lynn. Quinn Nguyen, being pinned by Patrick Nguyen. Angela Danelle Adamos Nidanwa, being pinned by Marie Dulce Ndwaza. Eileen Mary Tess Paco, being pinned by Edward Paco. Lorna May Pascual, being pinned by Guillermo Pascual. Nayana Pakti, being pinned by Songchai Pakti. Joseph Allen Ramos, being pinned by Domingo and Grace Ramos. Joshua Satsad, being pinned by Roel Satsad. Lisa Tongmenivong, being pinned by Amy Tongmenivong. Kelly Marie Trinidad, being pinned by Linda Trinidad. Dulce Uriarte Sanchez, being pinned by Ilana Uriarte. Jasmine Valverde, being pinned by Hayla Kendris. Rona Marie Verano, being pinned by Ronald Verano. Maylin Vin, being pinned by Vincent Vin. Destiny Weisslogel, being pinned by Curtis Vetter. Morgan Wolf, being pinned by Jordan and Holland Wolf. Kathleen Carol Wong, being pinned by Christy Wong.
Okay, well, the two Would the MSN students please rise and come up to the stage? Jeffrey Dwayne Clem. Mandeep Kaur Fangura.
Well, this is indeed a proud moment for all the graduates. You are here this evening to be recognized and congratulated, and I would like to encourage all of you to continue the lifelong learning, to stay current in your practice, and to always adhere to professional standards of nursing practice. Graduates, please stand and raise your right hand and pledge to the nursing oath together. I invite all nurses present to stand and join us as well. You will find the nursing oath written on the last page of your program. Taking the nursing oath is our pledge to always perform at the highest level and to provide the best care possible to patients, families, and the communities that we serve. So repeat after me. In full knowledge of the obligations I am undertaking, I promise to practice professional nursing with all my skill and the understanding I possess. Without regard to race, creed, color, politics, or social standing. Without regard to race, creed, color, politics, or social status. Of those entrusted to my care and sparing no effort to preserve the quality of life and alleviate suffering. And to promote health care as affirmed by the person. I will respect at all times the dignity and beliefs of the patients under my care. Holding in confidence all personal information entrusted to me. And refrain from any action which may endanger life or health. I will endeavor to keep my professional knowledge and skills at the highest level. And to give support and cooperation to all members of the healthcare team. I will do my utmost to honor the International Code of Ethics applied to nursing and to uphold the integrity of the profession. Thank you and congratulations.
One last time, okay? So at this time, we would like to recognize the members of the Nursing Honor Society. Students are eligible for membership as long as they meet requirements on or before the designated due dates. Students will have demonstrated superior academic achievement, academic integrity, and professional leadership. The asterisk after a student's name in the program indicates that the student is a member of the Roseman Nursing Honor Society, as with the gold and purple honor cords that they wear during graduation. So graduates, please stand as I call your name, face the audience or your family members, and remain standing until all students' names have been called. Zachary Blumenstein. Roy Alexander Corpus. Stacy Donna. Altricon Herrera. Gabriel Hidalgo. Gabriel Hidalgo. Nicole Kaling. Nicole Karasenko. Carlos Lopez. April Navarrete. Samu In. Angela Nidauza. Aileen Peiko. Naya Pakti. Joshua Sadsad. Lisa Tominebong. Kaylee Trinidad. Jasmine Valverde. Rona Verano. And Caitlin Wong. Please join me in thanking the 2022 Nursing Honor Society members for the various services they have provided to the community, the nursing profession, and to the Roseman University of Health Sciences. You may be seated. Thank you.
Hello, everyone, and congratulations, students. Founded in 1952, the National Student Nurse Association is a non-for-profit organization for students enrolled in nursing programs. It is dedicated to fostering the professional development of nursing students. This association promotes each member to build their leadership skills in conflict resolution through shared governance and community with respect for others. Student nurses in SNA make their own decision based on fiduciary research, historical, and current evidence. They are encouraged to take full advantage of their education and develop their professional leadership skills through collaborating with other members of the healthcare team and providing hands-on care to clients. The many activities participated by these students develop continuous lifelong learning and ethics of the profession. These students are known throughout the community and for their hard work and compassion. I am very proud of these students who have demonstrated their integrity, compassion, humanity, and professionalism, and would like to recognize them today for their contributions to the community. Members, if you could please stand when I call your name. Gabriel Hidalgo. April Navarrete. Angela Nidwaza. Eileen Peco, Joseph Allen Ramos, Lisa Tong Monivon, Kelly Trinidad, and Destiny Wise Logal. Congratulations.
Congratulations. I am so proud of you guys. The Critical Care and Emergency Student Nurses Association, or CESSNA, was established to help students interested in the critical care and emergency nursing fields have a platform to learn more about each specialty. The organization focuses on educating students through presentations from specialists, promoting nurse apprenticeship opportunities, and doing volunteer work for the local community. During a disaster, the advanced triage system utilizes a color coding scheme. Red tags are used to label those who cannot survive without immediate treatment, but who have a chance of survival. CESSNA chose the color red to honor this system. Each CESSNA member proudly wears the red cords to symbolize their devotion to the nursing profession. Our CESSNA students have been busy this past year with the following events: Stop the Bleed, COVID and flu vaccine clinics, blood drive, Safe Kids training, hosting guest speakers, donating masks, and helping the Women's Center drive at Shade Tree. CESSNA members, please rise as your name is called. Justina Anderson, Zachary Blumenstein, Francis Calara, Stacy Bonilla Donna, Jenny Ha Dorsey, Trisha Gartley, Alfricon Herrera, Gabriel Caberto Hidalgo, President, Felicia Nicole Holmes, Nicole Kelly, Nicole Kerosenko, Carlos Lopez, Sam Yu In, Quinn Win, Angela Daniel Nidwaza, Eileen Paco, Secretary, Lorna May Pascual, Joseph Allen Ramos, Joshua Sadsad, Kelly Marie Trinidad, Dulcie Uriarte Sanchez, Jasmine Valverde, Rona Marie Verano, Maylene Vin. You may be seated.
Aloha, I'm Dr. Mary Faye Axon Armstrong, and I'm delighted and honored to acknowledge this group of graduates. I was gonna call you students, but you graduated already. At this time, I would like to recognize the graduates of the Registered Nurses in Primary Care Scholars, or RNPC Scholars. The purpose of the RNPC Scholars is to recruit and train nursing students to practice to the full scope of their licensure in community-based primary care teams, both in rural and urban settings. The RNPC graduates are, please stand when I call your name, face the audience, and remain standing. Justina Anderson. Roy Alexander Corpus. Carolina Eileen Ila. April Ringpis Navarrete. Angela Danelle Niduasa. And Maylene Maisie Vin. Remain standing, please. The goals of the RNPC Scholar Program includes increasing the number of undergraduate students who are committed to practicing in rural and underserved areas, addressing population health outcomes and public health needs of underserved populations, thereby decreasing disparities of healthcare and improving the quality and access to healthcare for populations. The RNPC scholars received over 150 hours in primary care training. This included providing care within primary care settings in urban and rural settings in Nevada. The scholars were able to see the full impact of providing care within team approach and developed an appreciation of the obstacles encountered by clients who sought care at primary care sites in rural Nevada. Again, congratulations to our RNPC scholars for their many accomplishments and contributions.
Good evening. Congratulations, graduates. It seems like yesterday I was in my sorting hat and putting you in groups, and now you're graduates. So hello, everyone. Congratulations again to the students. My name is Eric Dillon. I am the advisor for the LGBTQ Student Association. The mission of the Roseman University of Health Sciences LGBTQ Student Association is to create a safe and supportive environment for university students identifying as LGBTQ, their allies, and for the purpose of creating a sense of community within, to work and create a positive image for LGBTQ healthcare workers in the community at large, as well as to promote the overall health and wellness of LGBTQ students. As a member of the association, members participate in various events that include LGBTQ lecture series, fundraising efforts, as well as the annual Pride events within the Las Vegas community. I'm very proud of these students for their contributions to bringing awareness to issues concerning the LGBTQ+ community, particularly in healthcare. With the members of the LGBTQ Student Association, please stand as I call your name. Roy Alexander Corpus. Gabriel Hidalgo. Nicole Kelly. Rona Marie Verano. Congratulations. Thank you.
Aloha again. I am the faculty advisor for the Asian American Pacific Islander Nurse Association of Nevada, Roseman University Student Nurse Association, APINA RSNA for short. The first state chapter of the APINA of Nevada was officially formed in March 2019. The goal of APINA Nevada and APINA RSNA is to unify APINA nurses in Nevada and beyond, to facilitate and promote networking, and to develop collaborative partnerships between professional nurses, nurse researchers, nurse educators, advanced practice nurses, and nursing students and community affiliates with the sole purpose of identifying the healthcare needs of AAPIs and optimizing resources to promote healthy living and better their lives. APINA RSNA students were involved in various community outreach for ethnic minority populations, specifically the Asian Pacific Islanders and other minoritized population. In the year 2020, amid the COVID-19 global pandemic, the students participated in the free drive-up flu clinic and distributed over 1,000 frozen foods to families at the Las Vegas Chinatown Mall. The past 2 years, APINA RSNA partnered with the APINA of Nevada and Nevada State College and gave away blankets and lunch meals to the homeless population at Northern Las Vegas. Last year, May 2021, in celebration of the annual Asian American Pacific Islander Heritage Awareness Month, Commissioner Justin Jones and the Clark County of Nevada Commissioners recognized and honored APINA of Nevada and APINA RSNA, that's us, and for our contribution and participation in the Asian Community Development Council's pop-up vaccine clinic in the Chinatown, Las Vegas, with a goal of vaccinating 1,000 people, all business owners and ACDC client population. The recognition and award included our Healthy Monday and radio shows on PHLV radio for increasing health awareness and vaccine confidence among the ethnic minority population, from which some of our APINA RSNA members were guest speakers. This year, 2022, APINA RSNA reached out to 55+ active adults community and provided 70 COVID-19 booster shots and health screening, blood pressure, BMI, blood glucose, and cholesterol in partnership with ACDC, Immunize Nevada, Optum RX, and our very own Roseman University Filipino Advancing Towards Health College of Pharmacy students. We gave away over 200 free COVID home test kits from the Southern Nevada Health District. And as the founder and immediate past president of the APINA Nevada, on behalf of our founding members, it is our hope to instill the passion and purpose to our nursing students and increase their cultural awareness. Everyone, please hold your applause after I've called the members so everyone may hear and acknowledge each student. Students, please stand up as I call your name, face the audience, and remain standing. I promise I will tell you to sit down this time. Okay, Zachary Blumenstein. Roy Alexander Corpus. Jenny Ha Dorsey. Altricon Herrera. Nicole Kelly. Quinn Wynn. Nayana Pakti. Lisa Tong Manivong, Rona Marie Verano, and Kathleen Wong. Please give the students your encouragement and support to persevere and serve our AAPI communities. Congratulations.
All right, a few awards to give out, and we'll wrap it up. So the first award is a Spirit of Nursing Award. The recipient of the Spirit of Nursing Award consistently models exceptional behavior, professional behavior in clinical practice, in school activities, and in classes. This year's recipient has shown outstanding leadership skills amidst the COVID global pandemic. The recipient is involved in donating time to animal shelters, a COVID clinic, and health screening facilities, and also participated in the Masters of Science in Nursing intensive residency. Here's an example that shows how the recipient exemplifies the Spirit of Nursing Award. During a clinical rotation, the recipient was asked to keep an eye on a patient who was deemed manipulative by other workers. The recipient encountered this patient while helping deliver breakfast trays. The patient asked the recipient to help with a few, including throwing away the remainder of the patient's previous meal and rearranging the side table. Later in the day, the recipient came back to do the morning assessment and check vital signs. During that short time, the patient began talking about her experience in the hospital, which included suffering discrimination and hearing staff members say that she was a drug user and manipulative. This made the patient feel uncomfortable. The recipient offered to sit with the patient during the physical and occupational therapy, gave the patient her medications, and joined in patient's religious prayers. The recipient was friendly, welcoming, and accessible, and both patient and the hospital staff came to appreciate how the recipient offered to help the patient in so many different ways. From that experience, the recipient learned that it is important to treat even those most difficult patients with dignity and respect and to always be a good listener. These things can make a real difference in creating a caring, compassionate environment. The recipient of the Spirit of Nursing Award is Lisa Thongmanavang. So we actually have 2 Spirit of Nursing Awards this time. So the second recipient is a member of various organizations inside and outside of school, including the Honor Society, National Student Nurse Association, and Roseman Student Nurse Association. Is also an active member of the Registered Nurse in Primary Care, the RNPC group, COVID vaccination clinics, and the Family Nurse Practitioner Residency, and helps medical staff at the community events and at the Eye Care Adult and Pediatric Hospice Facility. Here's an example of the recipient's clinical experience during the mental health and med-surg rotation. The recipient was tasked with helping to care for a patient who was schizophrenia and bipolar disorder and who was calling for her nurse because the patient was very anxious and needed assistance. The nursing staff had been busy the entire day. The The recipient decided to take the initiative and assist the patient who was frail and needed assistance going to the bathroom. The recipient helped the patient to the bathroom several times throughout the shift and answered all of the patient's call lights. The recipient also helped with the patient's daily living and morning activities. The patient was especially appreciative because this was the first time someone had assisted her with grooming during her stay in the hospital. The recipient also took time throughout the day to give the patient updates on the plan of care. During these encounters, the recipient learned more about the patient's life. The patient told the recipient that her husband, who was also in the hospital, and did not have any other family members to visit her. Gradually, the patient became comfortable with the recipient and was able to joke. Soon, the patient began to ask for help from the recipient specifically, and they were able to continue building a good rapport with each other. The clinical professor and staff commend the recipient for providing excellent care to the patient and making a difference. The recipient says that being able to see the patient smile and laugh throughout the day is something to remember for the rest of their nursing career. The patient care experience helped the recipient gain a deeper appreciation of the nursing profession as an excellent field where you have opportunities to help people and make a difference. Nursing is challenging, but is also a very rewarding profession. This recipient of the Spirit of Nursing is hereby awarded to April Navarrete. All right, the Dean's Award. The recipient of the Dean's Award is a member of various organizations inside and outside of school. They volunteered at the Kiwanis family, whose service is focused on serving children. In addition, volunteers at the Las Vegas Young Professional Kiwanis Club events, which include cooking dinner for families staying at Ronald McDonald House. At school, the recipient volunteered at the Family Nurse Practitioner Residency and the COVID Vaccine Clinic. The recipient is a member of the RNPC program, Honor Society, and the Asian American Pacific Islander Nurses Association, the Roseman LGBTQ Association, and the Medical Emergency Response. During a shift report in the recipient's clinical experience, the recipient was assigned to a patient who was described as a difficult patient. During their initial interaction, the recipient became aware the patient spoke very little English. The patient's language was Tagalog. The assigned nurse and the recipient attempted to use an interpretive service called Language Loon. However, this frustrated the patient even more. Other individuals of the care team dismissed the patient as being difficult because she responded in short one-word answers. The patient did not fully understand the staff and could only respond by saying yes, no, and I don't know. The recipient did their best to assist the patient with activities of daily living, all of which were as simple as needing to use the bathroom or having suction changed because it wasn't suctioning anymore. Because of the recipient's effort, the patient expressed gratitude and agreed to have the recipient follow and observe the patient's bronchoscopy the following week. This experience showed the recipient just how a negative patient's experience can be due to a language barrier and the value of patience and perseverance. This experience had a huge impact, and the recipient vowed not to let a language barrier frustrate a patient under their care again. The recipient of the Dean's Award is hereby awarded to Roy Corpus. All right, as we complete the formal part of our ceremony, I'd like to share just a few parting words from our graduates, since it's the last time I have their attention as a group. Not that I ever had it in the first place, but I like to think I did, at least maybe at orientation for a minute. So you're now entering the world as a professional registered nurse, right? You're no longer student nurses. You represent the future of our profession. You're gonna have lots of challenges throughout your career. Every day, when you meet those challenges, ask, how should I be? Not what should I do? Think about your character, your values, and your virtues, your ability to act outstandingly. Your journey of discovery does not end here. Continue to ask yourself in each new situation, how should I be? You've mastered the 5 rights of medication administration. I know there's more. Okay, we don't need to quibble, but 5 works with my speech, right? So I'm going to leave you with a new set of 5 rights, and that is always act at the right time regarding the right thing towards the right person with the right intention and in the right way. Be the role model for those you interact and care for. As you go forth and be fruitful, remember, watch your thoughts for they become words. Watch your words for they become actions. Watch your actions for they become habits. Watch your habits for they become character. And watch your character for it becomes your destiny. Now go out and do good. All right, families, friends, graduates, this concludes our pinning and white coat ceremony. Thank you for being here this evening. The students could not have completed this rigorous program without your support and encouragement. Thank you. I would ask that the audience please remain seated as the faculty and students proceed out of the room. I promise they'll be right back. We're not keeping them any longer. They have completed their educational journey with us. And then please join us for refreshments in the back. And cue up the music.